great pride for all of us. And I feel extremely proud to be a part of Apollo Proton Cancer Center, which is equipped with the first proton beam therapy in Southeast Asia, the country and South Asia's first digital PET-CT here. And all this has been made possible only and only due to the vision of our chairman for providing the best possible care to our patients. So over the last couple of years, there has been tremendous advances in the field of oncology. And along with it, there has been simultaneous advances in the field of medical imaging technology. And digital PET-CT is one of the recent advances for which we have all gathered here today. And this is one of the latest advances in the field of molecular imaging technology. So I'm not going to be talking mainly about PET-CT, but I'll talk about the advantages of PET-CT. This is a patient with breast cancer with left axillary lymph node metastasis, and PET is able to identify a small tiny lesion in the liver where the corresponding CT sections are unremarkable. The ability to identify small unsuspected sites of metastasis which can alter the treatment plan. The ability to identify early bone marrow lesions much earlier before the destructive bony changes become apparent.
It becomes even more important that the equipment that is used for diagnosis is extremely accurate and can catch really very tiny tumors so that then they can be treated with this high-end equipment. And that's where this fine piece of technology from Siemens is coming very handy. It's called a Biograph Vision, and this is the digital PET with an added feature of flow motion. So to keep it a little bit simple for my friends in the press, let me try to explain this critical feature of flow motion. So typically what all other PETs typically do is when they image a patient, the patient is lying on the bed. So they take an image of one anatomy, then the patient bed moves ahead, then the next image is taken, and the next is taken, and the next is taken, so till we cover what we call as the whole body. So in flow motion, with this digital PET, what you do is you do not take pictures individually and then you do not stitch them up together to create a whole body image. Rather, it is a continuous imaging process. So you could kind of imagine it like taking a series of photos and then stitching them up together as a video, or directly shooting a video. Yeah, here the table moves continuously as the imaging is happening, and that's where the flow motion brings in a lot more accurate scanning. It's faster, and it also gives it opens up newer applications for parametric imaging. And this is where the flow motion technology kind of differentiates this equipment from the rest. And this is the first unit in South Asia we are installing. I congratulate Dr. Reddy and the entire Apollo team for going with this technology, which will be extremely a good complement to the proton therapy unit that they already have. Thank you.
Thank you, sir. It's always a privilege to be with the Apollo family and members of the press. Thank you for coming here today. Today I just want to make 3 points. The first is to talk about Apollo's clinical DNA. Our focus has always been on the clinical outcomes, and because of this, it has made us pioneers in the field of healthcare. We started 35 years ago. We started by bringing the first corporate hospital to India, but that would not have made any sense if people like Chairman didn't have a vision to bring the healthcare of international standards to India at a fraction of the cost. That's what drove us to to bring the first maybe 160 slice CT, to bring the first today, to bring the first proton to India, not only to India but to Asia, and to bring this digital PET CT to India. But this is just equipment. What is more important is the fact that Apollo is concerned about the 360-degree care that surrounds the equipment. So we need to provide everything that we can to make sure that the patient gets well, and it's a clinical outcome that counts. So in this journey of looking for great clinical outcomes, sometimes we invest in medical technology and we combine it with the best clinical care. Apollo was probably among the first to look at precision medicine, to look at liquid biopsies and work with data labs. In this journey, today we inaugurate another special piece of equipment that is part of our journey in providing excellent clinical care. I want to end by saying that, every time, as these NCDs progress, they come up in different forms and different types. But at Apollo, we don't want to take a chance. We want to make sure that like he said, Vivek said, the diagnosis is very important. Post the diagnosis, I think we do everything that we can to make sure that the cure happens. And I want you to remember us for this, that Apollo is all about clinical excellence. It's about searching for a cure. And every time we're challenged with something new, I think we find even harder to make sure that we have that solution with us. Thank you for being here today with us.
I think we should all say India today feels proud that we have a Proton Center with several countries in this part of the world. Nearly 3.6 billion people don't have an access to a proton for treatment of cancer. I was also happy that today we are inaugurating another fine equipment, PET CT by Siemens. It takes me back when we inaugurated Apollo Hospital. We had a whole body CT scan, the first in India. The hospital in Bombay, Jeslo, Dr. Mehta used to continuously call me every week and say, "You are a big waster. You have spent 5 crores for one machine." And finally he came and saw the machine after 6 months. Then he said, "By God, what a wonderful thing it does, and what a way it changed the patient's treatment. I wish I could have one, I don't have money." So I called them, and they had a CT put up there on an installment basis. So that's our story. The first whole body CT scan in India. Now the first PET CT for Proton availability is now again by Siemens. Thanks, Siemens, because you are in a continuous advancement of healthcare technology, which will make a significant impact for people. It was important then. It is probably much more important today when the so-called NCDs, non-communicable diseases, as our Dr. Jalali, our director, said, it is like a tsunami. It's growing so rapidly. Especially the cancers, the World Bank said 33%. Actually, they say it's a 40%. It's galloping at that rate of 40%. Imagine at the end of the year, the prediction of World Economic Forum was 80% of all deaths will be from NCDs. What are these NCDs? Diabetes, heart, strokes, cancer, and infections. 80% of the deaths will be from these. Forget all the 800 diseases. These 5 diseases will compromise of 80% of the deaths. And then they said they will all die in less than 1/3 of their age. This is terrible, because it's not. We have already noticed in heart. About 3 months ago, one of my friend's son, 24-year-old, died with a heart attack. On the same day in the newspaper, all of you have published, a bride immediately after wedding, she was asked by the priest, go and see the lucky star. She never got up. And the mother said maybe she's poisoned. They did an autopsy, and autopsy clearly showed that it was an acute myocardial infarction. Last month, 2 incidents happened in the city. A 15-year-old went to write an exam, and he died there on the table. And again, it's a myocardial infarction. One of the superstars entered Amazon, and he was 21-year-old, and he had a myocardial infarction. So we never heard of this. I remember way back in 1974, in all of these 4 years of practice after coming back from abroad, I had 4 cases of 30-year-olds who had myocardial infarction. So when I mentioned it in the American College of Cardiology meeting in Chicago, they said, Dr. Reddy, Indians don't know the date of birth. I said, don't be foolish. They not only know the date of birth, they know the stars under which they are born. It's later, in 1982, in Los Angeles Cardiology Conference, suddenly they announced that 6 doctors did get up from their duty rooms, and all 6 of them were Indians. So then they started the studies and started blaming ghee. I said, ghee, I know my patients take not tablespoons, but teaspoons, they take tablespoons of ghee. Then they blamed coconut oil. I said, there's a state in India which not only eats all food of coconut oil, but they put all over their body every day, but they don't get heart attacks. So now we know, after a lot of studies that has been done, there is a gene which is a very important factor. Next is the environmental factors. These are the ones which are igniting the NCDs. It's occurring at such a rate which we could not believe, and I could say which we could not afford. You know, if you are going to lose a lot of young people, what is each country going to do? Unfortunately, the rate at which it's happening, the highest at the lowest income countries and the lowest in the high income countries. So I think it should be reversed. We cannot eradicate it. At least you must reverse this. So it's a very sad thing, but what I strongly believe is, if we all understand what these NCDs are, we will be in a better position. Whatever predictions that have been given, we can say this don't apply anymore. We can bring a stop to this. I give you a small example. I come from a very small village, about 100 miles from here. I had adopted 60,000, 170 hamlets, 60,000 people. Last 2 years, they have diagnosed 14 cancers, all operated in stage 1 and 2, so they won't have cancer. All their diabetes and hypertension are controlled, and the risk factors are taken up. There is no heart attacks the last 2 years. So I think and no strokes. So I think what is needed is the media helps us. If all of us think saying, I don't want to fall prey to NCD, I don't want my family member or my people who work for my firm don't want to fall prey to NCDs, we can achieve it. Please believe this. NCDs are all conquerable. You know, when we had a conference 3 years ago, they coined the term saying cancer is conquerable. When we had a conference inaugurating this, here on that day they said cancer is curable. So I think to cure cancer, we need gadgets like this. We have practically everything that's available for cancer. In all our 17 cancer hospitals, we have a whole gamut of treatments for diagnosis and accurate treatment of cancers. This place is special because we have one proton to serve all of our people. I don't know if this is going to be enough, but if it's not enough, I give you my promise. We will put up more protons. But before that, our aim is going to be to see how to stop NCDs. can be stopped by bringing awareness, because so many marathon players are dying. Because they're taking care of all of their physical health, but they don't know what their inside health is. You know, there are 90 million people who are after wellness. They do proper diet, they do exercises, they do everything, but they still don't know their state of health. I think the first thing to do is to find out what is the state of your health. So we have many things. I think way back 40 years ago, we put up one thing called the master health checkup, called it master health checkup. Now we have modified it out of experience of that master health checkup, and from the variety of population that we see, we have made that as a precision health check to diagnose if an individual's various functioning organs are well or getting into disease or already disease. So I think this is going to make a very big impact if we do the so-called screening, health screening. I call it bringing health check and awareness. What we have done on that day when that person, my friend's grandson died and that bride died, for all our Apollo families, for 85,000 Apollo families and their families, their dependents, we said we'll do a complete checkup for all of them. Whatever is the disease pattern, they will be treated. They will be monitored by our health coaches. They will get everything possible. So by third year, they will all be absolutely well. On that day, I said, I must take my, wish. I want to send a cake to the house to celebrate the wellness and happiness. So this is where I think all the countries participate in this health check program. We can diagnose almost all diseases and cure almost all diseases. But I think, as Dr. Jalali said, the incidence in our country itself is so high. We're not diabetic capital of the world, we're just there. China is holding that one title. We are cancer capital of the world, stroke capital of the world, the infectious disease capital of the world, and cardiac. Yeah. Cardiac capital of the world. I don't want these badges. I don't want this. I can go to the Bay of Bengal and throw it, or I can fly across and throw it in Indian Ocean. But I think for that to do, you and I must all cooperate. And the media, who are they become very influential. Almost everyone is hooked on to the television. I think if they can give this healthy news, it will make a big difference. Please tell them that every single individual, even if he is only a 15-year-old, in our Apollo family we are checking even 10-year-olds to find out whether his state of health is good or not. So I think if they go get the